Hi everyone, and welcome to week 11 of the summer vlog series here at Embodied Beings. This is the second to last week in this series. I can't believe it. It's been 3 months. And this is the final week that I'm going to talk to you about a specific health topic. I saved this one for last because it's not only one of my favorites and the one that had such an impact in my personal health and wellness transformation, but it's also something that is not talked about as much when it comes to yoga and yoga therapy or our overall health in general. There's still a lot of fear attached to this, and this is sexual health and the pelvic floor. So you may have heard of the pelvic floor or the pelvic floor muscles in reference to exercises like the Kegels, or if you've had a specific sexual health or sexual organ issue. But a lot of the contemporary research that's coming out in the past 5 years is targeting how the pelvic floor, the health of the pelvic floor and the PF muscles really is linked to all aspects of health. So of course, things like our joint stability and supporting the sexual organs and continence, sexual performance, but also some of the mental, emotional aspects of our health. And this is what I'm really interested in my own health transformation when it comes to yoga therapy, and also what an increasing amount of clients who are coming to me are interested in as well. So let's dive right in. Like I said, the pelvic floor muscles, they have lots of responsibilities for keeping our structure healthy and safe and in balance. And yet they go unrecognized so often, unless there's a specific issue in that region. So I get it, like this is common for our bodies in general. We don't tend to cultivate an awareness of certain things until they scream out in pain or discomfort, or something comes up in a health test that's saying, hey, something is off here, something is out of balance. But when it comes to our sexual health, there's still what I find is like so much fear and sometimes embarrassment, sometimes shame in sexual health challenges. And from my perspective as a woman and as a therapeutic yoga consultant, this is why it's good to keep talking about them, because when we talk about it and we seek out good validating information, then we start to learn and these things become less scary. So that's why I'm bringing it up in this series, and that's why I waited until almost the last week to do so. Healthy pelvic floor has a strong effect on our quality of life for pretty clear reasons, and our overall health in general. Some issues clients come to me with are incontinence, pain during sex, premature ejaculation, cystitis, irregular or painful menstruation, prostate issues, pelvic instability, poor posture, low back pain, even IBS symptoms, and of course, like difficulty orgasming, so difficulty with enjoying sex. And they come usually with a specific issue, and I get a sense of like what's going on in the pelvic floor by asking them questions. And we usually devise a program that helps to not only relax and strengthen, but cultivate an awareness of the pelvic floor and bring it into this really healthy and balanced sense of toning. So I'll go a bit into my story, some of it, and then talk to you more about the specific effects of yoga therapy and pelvic floor health. I came to yoga therapy, as you know from the digestion video in week 2 or 3, because of digestive issues. I had symptoms of IBS for many years, like cramping in the abdomen, a lot of difficulty there. And one of the things that my yoga therapist who I first went to noticed is that I more likely than not have had a hypertense pelvic floor. So there was a lot of stress in my pelvic floor. And mind you, I had barely even heard of the pelvic floor before coming to yoga therapy. I don't remember it being included in any of my sexual health education and formal schooling. So this was all new to me. And on top of that, I had no idea what my pelvic floor felt like. I didn't have any awareness. So this was a big project, cultivating an awareness of my pelvic floor and especially learning how to relax it. And it wasn't until about 6 weeks in, almost 2 months into consistent therapeutic yoga practice, that I even understood what a relaxed pelvic floor feels like, because it was tense all the time. And I've mentioned before in some of my videos how when our body or our mind is kind of stuck in a certain state, in a certain pattern of being, even if that pattern is unhealthy, it starts to feel normal. And this was the case for me in having a very stressed, hypertense pelvic floor. And it was manifesting in symptoms like it was contributing to some of the IBS symptoms, painful menstruation, sometimes irregular menstruation. There were even signs of hormonal imbalance, and certainly some pain and even numbness in some of the muscular trigger points in the pelvic floor muscles. So this was a lot to work with. But I started working with my yoga therapy program, and it helped me to cultivate an awareness of the pelvic floor so I could actually feel what was going on. And from there, understand more when I'm tensing it unnecessarily and when I'm relaxing it. And I started to establish more of this strong, healthy flexibility in the pelvic floor muscles. One of the terms that we use in yoga therapy to describe pelvic floor muscles that are both weak and tight is just weak tight. So when they're constantly contracted, even just a little bit all the time, these muscles lose their ability to have the flexibility to like relax and then contract and strengthen completely when we need them. They're kind of stuck in the middle. So a weak, tight pelvic floor, it has certain symptoms, and they were definitely showing up in my case. And after I started to become aware and work with my program, I was experiencing far less stress, improvement of my original digestive symptoms, much less pain and menstruation. PMS symptoms started to completely disappear, actually, and much more improved sexual health. So I've been working with it ever since, and I continue to learn more and more and go deeply within myself. And I'm able to also help clients through my own experiences, but also with all the research coming out and what I continue to study. I'll make a few main points now on how the yoga works, and I'll clue you in first on the process that we use to approach pelvic floor dysfunction and issues. And that's cultivating an awareness of the pelvic floor, teaching the pelvic floor how to relax, so going into deep relaxation of the pelvic floor, working with toning, so flexibility and strengthening to make a nice, even, balanced tone of the muscles, and then finally ending a practice with relaxation. And the main point here is that we're teaching the pelvic floor the difference between contraction and relaxation, instead of being in this kind of in-between state all the time that's often there in a weak, tight, or a hypertense pelvic floor. So that's the kind of yoga program that we use. And of course, it involves the mind. So awareness, it means placing the mind in the area of the pelvic floor that automatically increases blood flow to the area, and eventually over time, we can start to feel it more, and we can start to feel even the more subtle energies working in the pelvic floor. And this is what advanced yogis are doing in their spiritual practice as well. We use physical posture and breath to work with the pelvic floor, and of course placing the mind in that area. And we know from even basic studies from physical therapy and clinical trials and things like this that breath and posture very directly affect the physical body, but as I've said many times, they also affect the other 4 bodies of our being: energetic, emotional, mental, and even the spiritual body. In the pelvic floor, I've noticed connections particularly within the emotional body of the clients who come in to see me. And contemporary medicine is starting to show this as well. Doctors are very interested in the connection between pelvic floor dysfunction and heightened states of anxiety and depression, even PTSD, things like this. And they've found through an array of studies, especially between 2008 and 2015, that working with pelvic floor dysfunction and addressing pelvic floor dysfunction has an effect of improving qualities of states of mind. So decreased anxiety, decreased depression. There are a lot of specific studies that work with men, that work with women, that work with different aspects of mental health, but this is the basic truth that they've found, that there's a strong correlation between severity of anxiety and depression symptoms and severity of pelvic floor dysfunction. And we see this and understand it from a therapeutic yoga perspective because we always in yoga therapy acknowledge the effect of emotional traumas being stored in the tissues of the body itself. So we study trauma as a somatic experience, as a lot of somatic psychologists are finding now too. And we're finding that in yoga therapy, that it's not like just sexual trauma that would be stored in the sexual organs and in the muscles in that area. Any sort of trauma can store itself in certain tissues of the body. So by working with the pelvic floor and teaching these muscles to relax and release, we're able to address the tension that's stored in the tissues and start to release that as well. And this is, again, one of the most exciting topics that's coming up in like mind-body connection, in somatic psychology and neuroscience, this experience of trauma being stored in the tissues of the body, and of course using the body to release it. And yoga can help to do this in a really holistic way. And finally, overall, working with yoga therapy, sexual health, and the pelvic floor, it just improves our quality of life tremendously. Even if you have never experienced any issues in that part of the body, addressing the pelvic floor, it tends to improve quality of life through increasing our awareness of a part of the body that generally doesn't have so much awareness, decreasing any pain that might be there, chronic pain and stress, increasing stability of the structures of the body, improving tonicity and stability in the pelvic floor itself, and of course improving the potency of a spiritual practice. And this is something I won't get into here, but something that I've studied as a yogini myself, as a serious practitioner of classical hatha yoga, that the pelvic floor energetically, it's the area that we need to work with to really improve certain aspects of our spiritual practice rather, and start to experience those altered states of consciousness. And for health, it's excellent too. That's all I have for you this week. Thank you so much for tuning in, and I will be back next week, week 12, with some final offerings and finally the news on what's next for embodied beings. Thanks so much. Have a great weekend. Bye.